My name is Edith Zalkind. I'm a physician's assistant, and I'm one of the medical staff here at Positive Choice Integrated Wellness Center, and I am here today to help you get started on your new meal replacement program. All right, so we are no longer doing week one, so on week 2 you will be coming into class. Your week 1, your counselor will get a hold of you. You're going to come into clinic during our open hours. You'll be greeted by screeners in the front of the building that will ask you some COVID questions. And then from there, you'll be directed up to our 4th floor where you will check in and pay and tell us which flavors you want of the product that you are getting. And then from there, you'll be directed up to the 6th floor where you will do your medical check-in. There you'll get your letter of medical instructions that looks like this, and one of the medical assistants will go over this with you. All right, so this is what the letter looks like. It's 2 pages, or it'll be double-sided. On the top, it'll tell you which program you are going to be on, a full fast or a modified full fast. It will tell you what product you're going to be on, NutriMed, OptiFast. And then beneath that, it's going to tell you whether or not you are mandated to have soup or if you can just have it as a bonus. If you have certain medical conditions or if you are on certain medications, you will be required to take at least 1 serving of something salty a day. Now, there are 2 types of salty things. There is the OptiFast or NutriMed soups, and there is the Fulfill broth. The Fulfill broth is not a meal replacement. The NutriMed or OptiFast 800 soups are a meal replacement. In other words, they take the place of a shake, and you can have up to, at most, you can have 2 servings of something salty a day. So that means that if you're having 5 shakes and you want something salty, you can have 1 or 2 Fulfill broths. And if you are having 4 shakes, you can have 1 OptiFast 800 or NutriMed soup, or 1 Fulfill broth. And if you're having 3 shakes and you're having 2 of the OptiFast or 800 soups, or OptiFast or NutriMed soups, then you can have 1, or you can have no Fulfill broth, none, right? So hopefully that's kind of clear. And if you have questions, obviously, please call. Beneath that in your letter, it is going to tell you medications that you should discontinue and medications that you should continue. Broad category of medications that you are going to stop. Diabetics, we're going to take you off your diabetic medications, which is fine because we're monitoring your blood sugars here with lab, and you're going to monitor your blood sugars at home. And between the 2 of us, we generally manage to keep our diabetics really well controlled. What you'll notice, diabetics, is because we take you off your diabetic medications is you are going to possibly see a spike in your blood sugars, maybe a lot, maybe a little. If they go above 300, you call us and we will help you manage that. Otherwise, those blood sugars should kind of slide into normal within the first week or 2. And if they don't, you'll probably be getting a phone call from us, and we may have to put you back on some medications. Most of our diabetics stay off medications while they're here, especially if they're not eating, of course. But on rare occasions, we do put people back on medications, and that's usually a rosier picture, smaller doses, being able to do away with insulin, and then long term as to whether or not you get to stay off your diabetic medications depends on how much weight you've lost and what you're eating and your genetics and how long you've been diabetic. So a whole host of things, so no promises, but again, if you've lost a significant amount of weight, if you're eating healthfully and exercising, chances are at minimum it'll be a rosier picture and you're not taking as much medication, if possibly any. So no promises, so don't throw away any diabetic medications. Another broad category of medications that we take you off of are diuretics. Hydrochlorothiazide, Maxide, Lasix, spironolactone, all of those are diuretics or water pills. We take you off of them because the product has a lot of protein and very little carbohydrates in relationship to that. And so what that causes is a diuretic effect. There are no diuretics in the actual product, but it's a metabolic trick, and it just creates a diuretic effect, so we don't want your diuretic and the diuretic effect of the shakes to work together, so we take you off your diuretic. Most people are on diuretics are on them for blood pressure, and some people are on them for swelling. Blood pressure folks, what you'll probably notice is that your first week's worth of weight loss is going to do pretty much what your diuretic is doing right now. So generally we don't end up having to put people back on them, but people who use it for swelling, sometimes it depends. We do end up putting you back on some diuretics. But again, a majority of people stay off their diuretics while they're here. And again, if we end up putting people back on diuretics, it's usually at smaller doses and kind of rosier pictures. And then long term, whether you get to stay off of it, again, depends on all the same things that we spoke about with the diabetes. All right. Beneath that, it'll talk to you about new prescriptions, and in particular, specifically, potassium. Optifast 800 has been reformulated, so there's enough potassium in it now, so you don't actually have to take extra potassium. But Nutramed does not, and the Nutramed people do have to take, and if you're on Nutramed, you will have to take a potassium supplement. And potassium is exquisitely important to muscle contractility, or how your muscles contract or perform. Function, there's the word, function. So your heart is a muscle, and that's why potassium can be such a serious, is such a serious medication, and we really expect you to take it the way it says on your bottle every single day. Potassium abnormalities that are far enough out of range, really, really, really high or really, really, really low, present as cardiac arrest. So cardiac arrest is when your heart stops beating. So it's not like a heart attack. Heart attacks you can generally survive, but cardiac arrest is very deadly. And so obviously, that's why we monitor your potassium here, but the expectation is that you take your potassium the way it says on your bottle every single day. Some of you will be on 1, and others of you will be on 2. Please make sure that you take it. It depends on other medications that you are on, so please make sure that you take it the way it says on your prescription. You have 24 to 48 hours to fill that prescription. If you are a Kaiser member, there is a prescription waiting for you at any Kaiser pharmacy. And if you are not a Kaiser member, you should have gotten a hard, like a paper prescription when you came in for your physical. If you did not, or if you've misplaced it somehow, please contact us as soon as possible, because you have 24 to 48 hours to fill that prescription before it becomes dangerous. All right, and then over-the-counter medications, Tylenol, ibuprofen, decongestants, antihistamines, cough syrups, or cough medications, upset stomach stuff, all that kind of stuff, generally okay, keeping in mind 2 things. A, you are taking this on essentially an empty stomach, so large mega doses are really not necessary. You might want to start with a little bit and increase up if you need it, recognizing that you might get a more profound effect than you are accustomed to getting. And 2, things that are liquid, in particular cough syrups, have alcohol usually and sugar in them, and those will take you out of ketosis. So what you want to do is make sure that you are taking a pill or a caplet or a tablet whenever it is humanly possible. Some cough medicines come in diabetic versions, and those are okay to take, but you would have to ask the pharmacist. And again, really, ideally, just stay away from them and use pills or tablets or caplets when possible. Vitamins, minerals, supplements. So if you're taking all 5 of your shakes every single day, and spoiler alert, you should be, then you are getting the equivalent of a multivitamin with 1,000 milligrams of calcium. So really, we don't aside from that, we don't really recommend taking a whole lot of extra anything. Your body does not store a whole lot more than what it needs in roughly 24 hours in regards to most vitamins. And so if you take a multivitamin on top of the shakes, it'll be filtered through your kidneys, and you'll get rid of it in your urine. So it's not dangerous, but it's probably not really cost effective. So we generally say you don't really need the supplements. There are a handful of exceptions to the supplement rule. If you are taking glucosamine and chondroitin and you're getting good joint pain relief, yay, take it. If you're supposed to take CoQ10, go ahead and take it. If you're supposed to take extra vitamin D, as in dog, go ahead and take it. Extra calcium, like 1,500 milligrams rather than the 1,000 that we have, you can go ahead and take a 500 milligram supplement. And then fish oil is kind of a head scratcher in that we know that it's good for your body, but it does have like 10 calories per serving in general. It's fat calories. It's not carbohydrates. It's not going to take you out of ketosis. I have some people who stay on it and they do fine, and some people who just do not want the extra calories and they do fine. So it's that one's kind of up to you. And then probiotics are fine to take as well. 800, again, OptiFast 800 has been reformulated, and so it now has fiber in it. Nutrimed does not, and fiber is really important because fiber is what makes you poop. And so we do not, for the Nutrimed folks, we do not recommend a wait and see approach on fiber. We recommend that you start taking it. We sell fiber here, so when you come in for your second week, you can tell the front desk that you would like to purchase some fiber, so you can buy our fiber here. Our stuff here is called partially hydrolyzed guar gum, and it's the nice thing about it is it kind of magically disappears in your shake. It's not gritty, and you can't taste it. And you can start with 1 to 2 scoops twice a day, and you can increase up to 3 scoops twice a day. You can buy other fiber if you want to. There's Citrusel and Metamucil and psyllium husk and chia seeds and flax seeds. All of that is perfectly fine. You must keep a couple of things in mind though. Number one, they do not disappear magically in your shake. So if you are a texture person, they kind of form something of a slurry, and some people don't like that. And so make sure that if you have a texture issue, you maybe consider taking a pill. Or using our fiber, and then if you can manage the texture, but you want to be careful about putting it in your shake in case you don't want to take the shake with the fiber. Also, fiber that is flavored like orange Metamucil or orange Citrusel, those that can have sugar in it. So make sure you read the label. There are sugar-free versions of it, so make sure you're getting the sugar-free version. And then you want to make sure that if you're taking all of your shakes and all of your fluid and your fiber, and you're not having a bowel movement every 3 days, then you take a laxative. Laxatives are things like milk of magnesia, or Dulcolax, or X-Lax, or Miralax. All of those are fine. And if you're still having any issues, of course you can give us a call. If you're finding that you have to take the laxative every 3 days without fail, you can consider adding a stool softener, and or you may want to consider getting something called Calm Magnesium. Now, you can buy this at Jimbo's or Sprouts or Whole Foods or Amazon, and I even think CVS has started carrying it. It comes in a powder. You want to start with 1 to 3 teaspoons, heaping teaspoons, at bedtime in hot water. Now, because it's at bedtime, you don't want to take it, you want to make sure that you're not taking it with a lot of water, right? So you only need a little bit. However, this stuff like fizzes and kind of expands, so don't like put a little bit of water in a shot glass or some small container because it will pour over. I mean, it's a fun science experiment, but you probably don't want that. So what you want to do, put a little bit of water, hot water, put your calm magnesium in it, and like I said, I would start with one because this can, like some people's stomachs can be kind of sensitive to this, so I'm kind of an overachiever. I'd probably skip to 3. I would recommend starting with 1. And the nice thing about doing it at bedtime is it can also help your sleep potentially. So it's not going to make you groggy, but it can deepen your sleep. So that's kind of an added bonus. All right. So also something to remember: potassium and fiber do not go together. So fiber can keep the potassium from being absorbed well, so you want to take them in separate shakes. So if you're taking fiber with your first shake, the second shake can have potassium. You can take the potassium with, or vice versa. Same thing goes for shake 4 and 5 in the evening if you're taking the potassium twice a day. Just no potassium and fiber simultaneously. All right. And of course, if you have questions, again, call. In your books, in the spiral notebooks, on section C, page 14, there is a page called the Scoop on Poop or Stool Time, and it is a handout all about kind of what we talked about. The only thing that's not on there is this, and then a reminder that make sure that when you're taking fiber, you're taking it with loads and loads of fluid, because fiber that is not well hydrated is cement. It's going to do exactly the opposite of what you want it to do. So make sure that you're taking it with loads of fluid, and if you're kind of confused and not sure, you can either call us or look up in the book in C14 anything that any extra directions, but we're here to support you, so like I said, feel free to call us. All right, so kind of the nuts and bolts of the shakes. There are 5 shakes in the program, so make sure that you're taking all 5 shakes every single day. People get here and they're really excited and they want to, they want weight loss to go quickly, and they figure 1 is good, then maybe, or 5 is good, maybe 4 is better. Well, that's not the case, and we don't want you doing that because, essentially what you're getting is a multivitamin that's cut into 5, right? So you don't take one of those meal replacements. You are looking at, you're looking at losing those minerals and vitamins and the protein. So make sure all 5 shakes every single day. Also, if your body, there was some science that went into the amount of calories that are in this. So if you push your body past that point of deprivation, it will chew up fat, which is what you want it to do, but it will also chew up muscle. And muscle is what makes you a fat burning machine when you leave here, so we don't want to do that. And then also your body will not take selectively from your thighs or your arms when it chews up muscle. It will chew up your heart muscle, which is not good, and we of course want to avoid that. So all 5 shakes every single day. If you are running out of day, but not out of shakes, and the question is, Adit, should I skip that last shake or do I double up? The answer is, in an emergency, double up. However, what you didn't hear me say is, I guess I can double these up. You don't absorb things as efficiently when you get too much thrown at you, and taking 2 shakes at the same time will not allow you to absorb things as efficiently. So we want you timing out your shakes. 2 to 4 hours between them is what we recommend. It just depends on how long or short your days are. And if you're kind of seeing your day come at you and you're thinking, oh gosh, I'm going to run out of day, you can move them a little closer together, an hour and a half. That's better than doubling up, but in an emergency, you can double up. You should be getting 120 to 150 ounces of fluid every day, and that's including your shakes. So everything that's liquid that touches your lips counts towards that total. Overachievers and underachievers alike If you take too little, you're going to feel yucky, and if you take too much, you're not going to feel good. So make sure that you are taking all the fluids and not too much, 120 to 150. All right, and then this is a liquid diet, and while alcohol is indeed liquid, you are not allowed to drink. So no Octafast mojitos or Nutramed margaritas or beer chasers. And then also no street drugs. And while I know that marijuana is legal currently, we still do not allow that while you're in the program. Having said that, if you are on it for truly medicinal reasons, please come talk to us. We have worked with patients that have been on it for medicinal reasons. There is no eating, and I know that might kind of seem obvious right now while we're kind of talking about all of this, but you know, for a lot of people, food is a coping strategy, and at the end of a long week, of a long and stressful week, and a lot of people's days are stressful right now, people get a little creative, right? You know, because we took away your whoopee, right? We took away your security blanket, and you know, a sprig of broccoli, maybe some pickles. A beet who gets fat on pickles. So, you know, I'm going to tell you right now, pickles are a gateway drug, and you don't want to be blacked out in front of the Jack-in-the-Box window wondering what happened to you, right? So, also, that's $140 pickle you're eating, right? You know, that's expensive. If that cost-benefit, I mean, if that cost-benefit analysis works for you, that's fine, but you want to consider that. A few more sort of pitfalls that you might come across. Caffeine. So everybody likes a good cup of coffee, but caffeine can be acidic. So it can upset stomachs. It can make you, because you're on so few calories, it might make you a little more jittery than you're accustomed to getting. It's a diuretic, so it can dehydrate you. So if you can do without the caffeine, great. But if you absolutely must have it, then one serving, which would be like a 12 or 13 ounce cup of coffee or a can of, you know, diet caffeinated soda or something like that, is acceptable. But if you are a pot a day drinker, you drink like one of those, you know, big things from 7-Eleven that you can bathe a toddler in of caffeine, you may not want to cold turkey that, because you are probably going to have a pretty serious headache. So you can do one of two things. You can either cold turkey and have a terrible headache for 3 or 4 days, and then you'll be fine. Or you can kind of decrease slowly until you get to that one serving of something caffeinated a day. Exercise is good, and we want you to exercise, but we do want you to listen to your body, because you're on, you know, a very low calorie diet. So that first week, you can consider, you know, kind of getting a sense of how you feel, and maybe sitting it out or doing kind of half of your normal program. That's fine. But once that first week is over and you've got your Octafast or Nutramed legs, you got to get out and get going. We definitely encourage exercise, and again, we do want you to pay attention to what your body is saying. So if you've overdone, oftentimes what people tell me is that they feel fine during the exercise, they feel really yucky afterwards. So if you're really tired or really feeling really yucky after your workout, you've probably overdone. You want to back up a little bit. Some things that might help you with working out is taking a shake before, like 20 to 30 minutes before. Some people take a shake, split it in half, and take one half of it right before and one half of it after. You can take a shake before and a shake after. If you're doing a particular spirited amount of exercise, you can go ahead and take a 6th shake. Or if you have a very long day, you can have a 6th shake, so that's fine. I believe we are still, because we are still manning phones, if you have, you know, working out questions, there are people that are here that will be able to answer those. Hot tubs, whirlpools, saunas, hot yoga, all of that. All of those activities dehydrate you very, very quickly, and people pass out when they get dehydrated. So that's dangerous. So we recommend you don't do it, but if you're going to ignore this particular warning, please do not do any of these activities alone, and make sure that whoever is there with you is capable of pulling you out of whatever activity you're in and taking care, like driving you out of the whirlpool or hot tub or something like that. So please don't do it, but definitely don't do it alone. Sugar-free gum and mints. People get a little orally fixated, like chew, chew, chew. Sugar-free gum, mints, and even cough drops are often flavored or sweetened with alcohol sugars. So you'll notice words like xylitol, maltitol, sorbitol, all of those are alcohol sugars, and those in large amounts will give you very uncomfortable gas and diarrhea. And believe me, it can be a fairly profound experience. We've actually had patients go to the ER with this, so please be judicious and careful about this. Start with like 1 or 2 pieces, and some people's stomachs are very sensitive, and they might have even that experience even with 1 to 2 pieces. The max that we allow or recommend is 3 or 4. But if you're finding that you're having a lot of gurgling with even 1 or 2 pieces, just stop. If it's a breath issue, because people get ketosis breath, you can go ahead and use mouthwash. Smart Mouth is a really good mouthwash, and a lot of patients over the years have recommended it and said it's very successful. So you can do that, or you can breathe on people and tell them that that's what smells like. The potassium is a wax matrix, so it's a pill that's made out of wax, and then it's kind of painted with the potassium, and your body kind of licks off the potassium and then dumps the matrix. So sometimes people become very alarmed because they will see what looks a lot like the pill that they took in their bowel movement. And so your body, and they get concerned that their body's not absorbing the potassium. Your body has already taken care of the potassium, that's already been removed and absorbed, and what you're seeing is the wax pill. So do not be alarmed, especially if if you get a little constipated. Sometimes you might see more than 1 pill in your stool, so don't worry, it's okay. So we will be here manning phones during our hours of operation. So if you have any questions, remember at the bottom of your letter, in the last paragraph, is our phone number. Although I know that some of the letters might have our old phone number, so our new phone number is 858-616-5789. That's the medical staff phone number. So please feel free to call us. We're here to support you. No question too little or silly or anything. Please reach out to us. We would much rather help guide you through something than have you try and figure it out at home and be confused. So if you need us, call us. Have a great first week. Good luck, make good choices, and we'll see you soon.